Well, hello, this is George LeMieux, Chairman of the Board of the Gunster Law Firm. On our weekly edition of A View from the Top, I am pleased to be joined by my friend, the Mayor of Miami-Dade County, the Honorable Carlos Gimenez. Mayor, welcome.
How you doing, Senator? How you been?
I'm doing great. It's great to have you with us. I was thinking in preparation for speaking with you today that having someone who's been a firefighter, a fire chief, a city manager, a county commissioner, and a mayor, a long-serving mayor of one of the largest metropolitan areas in the country, that we really couldn't have someone with better experience than you to deal with this pandemic. So thankful for your service during this challenging time.
Thank you, Senator. I really appreciate it. I guess it's my lot in life to be putting out fires all the time. So I do have a lot of experience, but nobody's written a book about this. This is not something really that you can, get trained for. I mean, you get trained for dealing with crisis, but this is a crisis that I don't think very many people have faced, at least in the last 100 years here.
It is an amazing time. If you would have said to any of us, in January or December of last year that we'd be going through this, I don't think we could imagine it. And here we are. Looked like things were getting better for a while, and our fellow citizens really followed the rules and hunkered down. And now we're reopening, but we're having some challenges. So I'd love to have you talk about where we are. I mean, this week we've had 5,000 new cases a day reported, which is a lot more than it was, 2-3 weeks ago. And tell us what you're doing, what you're seeing, and what do you think the next few weeks will look like for us here in South Florida?
Well, look, the issue is not so much the number, because we know that the number is completely underreported. We ran a study here in Miami-Dade that showed around 7% of the population had antibodies to the virus, which means that when you take that out to 2.8 million people, it's like 200,000 people. All right.
Wow.
So our positives right now are 37,000 or something like that. That's still way underreported. So I figure by now we probably have about 300,000 people that either have it or have had it in Miami-Dade. There's a good and a bad for it. The good news is that the mortality rate is a lot lower than people thought it was, because a heck of a lot of people have had it. We still have, somewhere in the vicinity of about 800, close to 900 deaths here in Miami-Dade, which is, far too many. But the mortality rate isn't as quite as high as what people thought it was. It's very, very contagious. And what we are seeing is, and what we think we're seeing, is we've seen a huge spike in people from 18 to 34 coming up positive, where we didn't have that before. We're not seeing that huge of an increase in the folks that are the most susceptible. We're not seeing a huge increase in the 65 and over residents. There has been an uptick, but not to the extent of the 18 to 34-year-olds. It's just skyrocketing. So what I think happened was, once we started to open up the economy, young people thought it was okay to do what young people do and have parties and get together and be close to one another and hug each other and all that. And also there may be some correlation with some of these protests. So a lot of protests. We had a lot of protests in Miami-Dade. Yeah, some of them were wearing masks, but they were all very close. They were all yelling. They were all, chanting. And that's how this virus goes out. And so you're really close. All it takes is one or two in that crowd to start spreading it around.
Right.
And before you know it, you've got a problem. I'm not saying that that's all of it, but that certainly had to be a contributing factor. And then we've had some restaurants that really weren't restaurants, that didn't do the social distancing, dancing, music, all that.
Right.
Really, they weren't allowed to do, that did it. And so I think it's a combination of all that, and probably young kids probably having parties, pool parties, whatever, in their home, again, getting close together. And I think that that's what's caused this explosion. Now we need to kind of tamp it down and take other measures to start bringing it back down again.
I saw that you're employing some surge teams to go into different neighborhoods where there have been hot spots. Can you talk a little bit about that for us?
Yeah, it's interesting to note. Not only do we have it's a demographic thing with kids 18 to 34, it's in certain areas, and the city of Miami is a really big hotspot. And there's certain zip codes in the city of Miami that are hotspots. And there's one hotspot down in South Dade, which we think is tied to the farm workers down there. And a lot of those farm workers work in very close confinement to each other, but they also live very close to one another and in small homes with a lot of people in them. And that's just a recipe for contagion. So what we're going to do is we're going to have at least 100 surge team members. They're going to go into these zip codes, start distributing literature, start educating the folks that live there that, hey, there's a high incidence of COVID-19 in this area. These are the things you have to do. We're also going to be carrying masks. We hope to have hand sanitizers, kits basically for them.
Right.
And then also inform them, especially if they have the elderly to stay away from the young and the younger that are going outside. And especially if they're going outside, you don't know what they're doing when they're outside, and they may be catching and bringing this back to your home. You, the elderly, and you, the young, have to keep away from each other, and in separate parts of the house. Hopefully, wash your hands, even wear masks if you have to indoors, away from each other. So, there's a whole range of things that they're going to be doing against education, but also giving out some supplies that are needed there.
Yeah, it seems to me that that's so important. When this first started, there was a talk, and a message to young people, take care, be well, do these things so your grandparents don't get sick. And, any place where there's intergenerational living, that's a challenge if the young people are doing what young people do, which is, enjoying their lives. But I appreciate that. The surge team sound like a great idea. I'm also hearing that when people are now checking into hospitals for what are called elective procedures, since those bans have been lifted, that people are showing up to get a gallbladder surgery and they're testing positive for COVID and they didn't even know they had it. So that must also be impactful in Miami-Dade County and some of these numbers.
Yeah, they are. And then so as soon as that happens, they're switched over as to a COVID-19 patient. And so that also could attribute to the rate of hospitalizations. That's really the key that I was always looking at. People are always going, gee, you had 500 more cases. I already know I had 200,000, so 500 to get me to 37,000. Okay. Right. Now, what's the rate of the positive? We were running, positive rates on our tests of about 8%, 7%, 9%, around there, always below 10%. Now we're running a couple of days have been over 25%.
Right.
And so, all right, the state is also doing contact tracing, and they're also doing, it used to be a shotgun approach. Now it's kind of more of a rifle approach. Hey, we know we have a problem in this area, so go test everybody in that area. And they're fighting, higher infection rates. But by the same token, we know that there, a lot of the people that work in hospitals happen to be young too, right? And so they needed to blow off some steam, et cetera, maybe, and they got infected, and maybe they're bringing it back to the hospitals. And so there are people that came into the hospital not being positive, did some kind of elective surgery, and then all of a sudden, boom, they're positive in the hospital. Right. Again, that switches over to a COVID-19. So, we're about 870 hospitalizations, hovering around 150 ICUs, and about 60 or 70 folks in ventilators. That's not troubling yet because we have close to 3,000 available beds, critical care beds. We have 500 ICU beds still available, and we have, close to 1,000 ventilators that are available. Ventilators not going to be the problem, I don't believe, because the doctors are using it less and less and less and less. We also have the ability to convert another 400 to 500 beds into ICU beds, and we have the ability to convert another 1,200 or so beds into critical care beds. So we're nowhere close to the capacity, but we don't want to get there. So we need to take measures now to start bringing this contagion level down, especially amongst the younger people.
So, Mayor, do you think that everyone's talked about the new normal? Is this the new normal until we have a vaccine? That we're going to be careful. We're going to go to our work to the extent we can. We're going to go to restaurants with social distancing. We're going to go to the supermarket. We're going to try to live our lives, but people are going to get it. People are going to go get health care for it, and then we're all going to just try to walk before we run until there is a vaccine. Is that what we're looking at?
Yeah, I think so. I think until you get a vaccine, or unless somebody develops some kind of antiviral that if you get it, we give you this and it cures you. That this is the new normal. This is normal, and normal probably until that vaccine comes out. You know, I guess I read somewhere where they think they're hopeful that the vaccine will be available before the end of the year. That'll be terrific. But if not, this is the new normal until we get that vaccine. The problem with this virus isn't its lethality, although it's probably more lethal than the common flu. The problem with the virus appears to be that it's really contagious, and so you're going to get more people are going to get it, and then even though the percentage may be somewhat higher than the flu, because so many more people got it, you're going to get folks unfortunately dying. And it really hits those people that are in the nursing homes and all. It's really hurting them. ALFs, people that have also comorbidities. It's I guess speeding them along fatally, and that's a problem. That's the people we're trying to protect.
You've had partnerships with the state of Florida and with the federal government through all this. Tell us about how that's going. Are you getting the resources from Tallahassee and Washington, D.C. that you need?
Yeah, we are. And look, we have a temporary hospital set up at the Miami Beach Convention Center, 250 beds there. Haven't used it. It's still open. It's still up. It's at great cost, by the way. It costs a lot of money just to have that in reserve. The state of Florida now is going to open up the old Pan American Hospital, getting at least 120 additional beds. That'll be used for nursing home patients that aren't serious enough to be in ICU, but they're not well enough to go back. And so we'll be using that facility for those purposes, which will alleviate some of the pressures on the hospital. Had very good working relationship with the governor, the PPEs, the equipment. We have plenty of equipment now, where we were having shortages early on in the pandemic. So equipment's not an issue. There's certain type of equipment that's not an issue. We're hearing now that the oxygen is becoming an issue. So we need to see what we can do about making sure there's plenty of oxygen, because now the treatment is oxygen, not so much intubation and ventilator. It's you breathing more, a higher concentration of oxygen. And so, there's always challenges to everything, but we're overcoming them, and the state and federal government have been terrific partners.
Well, in closing, Mayor, leave us with a message of what else we can be doing, what we should be watchful for as we work through this new normal.
My message is follow the rules. If you follow the rules, if you simply follow the rules, everybody follows the rules, will bring down this contagion level. Your chances of getting the disease, of getting infected, are very low if you simply wear a mask. When you're outdoors, if you're less than 6 feet, or you're going to be in a crowded situation, wear a mask. Indoors, always wear a mask. Wash your hands frequently. Use sanitizers frequently. Don't touch your face, and then you're always safer at home. Our safer at home order has never expired. And so, if you are elderly, if you have an underlying medical condition, you're always safer at home. So stay home as much as you can until this contagion level goes down. And when you do go out, until you have a vaccine, take these measures. Wear a mask, wash your hands, touch your face. And if you do that, you will be safe. Is it 100% safe? Nope. But you will really, really bring down the percentage, the likelihood of you getting sick with COVID-19.
Well, Mayor Carlos Gimenez, thank you, my friend. You're the right man at the right time to be leading us through this challenging time, and appreciate you being on Gunster's A View from the Top.
No, thank you, Senator. I really appreciate it, and you take care, and God bless you all.
We'll see you soon. Thanks.
Thank you.